It's hard out there. It's really hard. People are scared. You have to be empathetic and be compassionate.
The most challenging thing is seeing our nurses struggle with the volume of cases and the clinical illness that people are going through and the randomness in how it affects people.
Resiliency is so important right now because it's what our members need from us. They need us to be able to be there for them throughout this and to help get them the care that they need, the resources that they need, and to have somebody who's fighting for them.
This is the time where we as nurses are needed the most. This is what we've wanted to do. This is what we've spent the years of education for, and it's really a true opportunity to show our commitment, our effort, and our skill in order to help other people.
The toll that it's taking on people emotionally, physically, mentally is really, really different than anything we've ever seen before. So we're trying to combat all those things together and support people from a bunch of different fronts.
It's been incredible to work at the point of care testing site because we are working with our front store colleagues, our pharmacy colleagues, Omnicare, Coram, all different parts of CVS Health coming together. Minute Clinic providers, we're all functioning together.
Having a nasopharyngeal swab is not a pleasant experience. And yet, after they were tested, everyone always said, thank you.
Our members have a lot of questions about what's going on right now with COVID-19. And our IHL, or Informed Health Line nurses, are there to answer those questions and provide really fact-based information to these people. They are available to our members to field questions 24/7 through 65. And they've seen a 500% increase in their calls.
Having that kind of reliable person there for you 24/7 is really a great safety blanket for our patients and makes them feel safe, makes them feel like we're always going to be there no matter what, and we certainly will be.
I have a 400 member caseload approximately, so I'm still outreaching to those members and finding out how they're doing, seeing if they have an adequate supply of their medications, how are they going to get their food, how can they decrease their exposures, do they have other people at home who are out and working in the community and so forth, do they need to take extra precautions.
These patients have very difficult prognoses and diagnoses to overcome. They have very intensive medication regimens. COVID-19 is just a whole nother extra step they have to manage on their own in many cases.
So I had one member who was diagnosed with the COVID virus as well as diagnosed with diabetes. And I had to come in and work with him on the dietary information to keep his diabetes well controlled, as well as the COVID virus precautionary measures.
Providing emotional support has always been one of the most important parts of this job. Really being there with the person, really just listening to what they're saying, understanding what they're going through, understanding their perspective.
I love just being able to serve people. Just being able to give them the support that they need regardless of what their circumstances are.
We're supporting the care of those essential people who are putting themselves at risk each and every day for this COVID-19, but really making the economy and making our country move along in this uncertain time.
We're here to educate. We're here to care for. We're here to make the patient feel at ease. This is what a nurse has always done.
We really try to prevent our members from having hospital admissions. We prevent them from having strokes, from having heart attacks. We talk to them about important things to do to keep themselves healthy.
The more people that we can keep from contracting this virus, the more safe everybody will be in the hospitals, the more safe our society and our communities will be as a whole.
It's been an amazing time to be part of a company that has reached across all of its boundaries. Everybody has said, how can I help? What else can I be doing? where can I go? Our nurses are getting some of this gratitude and thanks, which we appreciate and is wonderful, but none of it could be possible without the help and support of every single person at CVS Health. Our store colleagues and our pharmacy colleagues and people behind the scenes are keeping us running, keeping our computers up and keeping, the prescription program going and helping us on the back end. I feel so proud to be part of CVS Health.